Although its cause is unknown, autism is a neurological disorder that affects a person's ability to communicate and to interact socially. Autism is 5 times as common as Down syndrome and 3 times as common as juvenile diabetes. Over the last 10 years, every state in the U.S. has shown a triple-digit increase in autism cases, with some geographic regions exhibiting a higher rate of incidence.
Even though Carter was our first child, I had read a lot of books on child development, and so it seemed like he had a very normal infancy. However, after his first birthday and the first few months into the second year of life, we really started to have some concerns that something wasn't quite right.
He did some unusual things. He would laugh really, really loud at his twin when she jumped on the bed. He'd look at a clock and start laughing that way, and he'd look at my mom's curlers and start laughing that way. And so I said, my sister called from Boston, I said, I just don't know what's up. I just wonder if he's autistic.
Around 15 months, he started some very unusual behaviors. He became withdrawn, stopped looking at us, stopped making that eye contact, and really began some repetitive play. Rather than pushing a car around, he would just take it and spin it around. He would take Tupperware out of the drawer and spin it around. Very odd behaviors. Putting all these things together, we started to have some concerns. In the back of my mind, I wondered about autism.
Dr. Lee Rosine is an experienced clinical psychology autism intervention consultant. He teaches and practices at Colorado State University. We spoke with him about the process of diagnosing autism.
There's a number of symptoms that parents should be focused on when they're concerned about whether their children may or may not have autism. One of the things that's most important is to look at whether their children lack appropriate social skills. The lack of socially appropriate skills relative to other children of the same age is one of the most important indicators as to whether a child has or does not have autism. What we're looking for here is whether they're able to relate both emotionally and socially to other children in play situations, whether they're able to engage their parents in conversation, whether they're able to carry a back and forth conversation with anyone. Those kinds of socially appropriate skills would be what we'd focus on.
So we started intensive behavioral intervention when he was 2 years old. And we worked very hard at it, about 40 hours a week. But it was fun at the same time. It was a very playful environment, and it was exciting to see him making progress, to see him learning. The things that come naturally for other children didn't come naturally for him. But this was a successful way for him to learn. The behavior that was rewarded was repeated, and he went from the age of 2 having no language skills and no play skills and no social skills to now being a well-adjusted 10-year-old who's doing at or above grade level work and is a wonderful, delightful part of our family.
What would you say to a parent or parents who had a child who was just diagnosed with autism? Well, I think the first thing I would say is that there's hope out there. There's a lot of people out there that are in similar situations. Graham has worked extremely hard, and we're very proud of his work. We're very proud of how hard he works. We know he is where he is today because of intensive behavioral intervention. And we continue to use that same approach, and he continues to learn. And there's no doubt in our mind that he will continue to learn the rest of his life. And there's no doubt in my mind that he will get better.